Malpractice claims can arise even when a podiatrist does everything right. Case Closed is a series that examines real malpractice cases so you can learn from them, protect your patients, and protect your practice. This case involves a Charcot reconstruction that ended in amputation and a lawsuit. Here is what happened. The patient was a male in his early 50s with severe comorbidities: obesity, neuropathy, diabetes, and congestive heart failure. He had bilateral Charcot deformities, with the right extremity more severe, and complete collapse of the talus. Bracing and Charcot walking boots had both failed. He came to the insured, seeking a second opinion and a surgical alternative to amputation. The insured recommended a talectomy with tibiocalcaneal fusion and calcaneocuboid joint fusion, combined with Achilles lengthening at the right lower extremity. Risks were discussed, including infection and potential loss of toe or foot, given the patient's diabetes and neuropathy. A below-the-knee amputation was also presented as an option. The patient declined amputation. The insured proceeded with reconstructive surgery as a salvage attempt. Postoperatively, the patient developed an infection. It resulted in amputation of the right foot and, ultimately, a below-the-knee amputation. 3 allegations followed: failure to obtain informed consent, failure to diagnose and treat the postoperative infection, and that the alleged departures caused the amputation. The case went to trial. The prosecution argued the insured lacked sufficient training in the reconstructive procedures. The defense countered with the insured's training logs, documenting prior experience. On informed consent, the insured testified that consent was obtained, the form was signed and witnessed, and the patient was advised preoperatively of his high-risk status. On the infection claim, the defense established there was no infection at the last visit with the insured, and the infection occurred 5 months later. The complications were not the result of any wrongdoing. The defense verdict was in the favor of the insured. This case highlights 4 risk management priorities. First, conduct a thorough informed consent conversation and document it with specificity. A generic consent form may not be enough. Second, know your state's informed consent standard. In this case, the insured was not required to disclose personal experience with the procedure. But if that information would influence a reasonable patient's decision, disclosing it protects you. Third, center the consent conversation on what a reasonable patient would want to know: the nature and purpose of the procedure, its risks, benefits, alternatives, and probability of success. Fourth, be direct with patients about the challenges of Charcot reconstruction. Cases like these are complex. Complications, including amputation, are real possibilities. Set expectations clearly and document that you did. This case was defended successfully. Not every case will be. The documentation and consent practices you follow today determine how defensible your care is tomorrow. We're here to help you practice with confidence. To reduce your risk and read the full case, visit our website and download the complete Case Closed publication.